The one good thing about Nagaland and people that I've seen is, as a society, we are more accepting of a lot of things. Do you feel like infertility issue is the acceptance or the resistance to fertility issues in a couple? Do you think it comes down to individuals, families, or as a society, are we resistant?
Actually, from my experience,
Hmm.
it ultimately boils down to the understanding of the particular family
Hmm.
or even those individuals. Because as such, since infertility itself is a very new topic, very new issue, just
Right.
like HIV was in the beginning. So there are many stigmas associated with it. So it's not that serious like it was during those HIV days, or there's some misconception about it. But with proper discussion and with proper counseling, um, people are realizing
Yeah.
the need for proper investigation testing and especially the involvement of both the partners in
Yes.
dealing with infertility. So I should say, as of now, uh, though our society, is not that, I should say, resistant about it, but ultimately it boils down to the individuals or the family concern.
Mm-hmm. And from the family starts the stigma more, and it hurts more. So,
Depends, yes.
right. According to you, then, doctor, what is the most common cause of infertility for both men and women?
Mm, Actually, these days, as we see with the uh, changing in the demographic what they call situation
Mm.
and about lifestyles, so I should say age is becoming playing a very important role in the recent this infertility. Like both the couples getting married late after, you know,
Mm.
uh, getting established in their own career,
Yes.
or maybe um, professionally achieving something. So
Yes.
I feel that's becoming a very important factor all over the world and including here also. And
Mm.
besides that, uh, there are some factors like how should I say,
Lifestyle.
infections. Infections
Mm.
definitely very important role. Different types of infections.
Yeah.
Another thing which I noticed is that um, in some couples, in some
Mm.
part of the population, there are people like where the couples, they lead very um, active professional or private lives, such that sometimes quality time cannot be given to each other, which itself it's a very important factor that leads to infertility.
Yeah, I would say that's the most important factor.
Like, yeah, like both the wife and the husband being posted professionally in different
Yes.
parts of Nagaland. Maybe someone posted outside Nagaland. So sometimes such issues I've also come across in my
Right.
uh,
And especially for the woman, getting the chance to get pregnant only once in a month, timing is so important. And if during the timing they have to go for a meeting or go on tour, then that's it for the month.
yes, that's what I've noticed. Yes.
So that's a rising concern in Nagaland also.
Yes, exactly.
Oh.
So we may not be, very fast-paced life like in the cities, in the metros, but definitely our population, especially the younger generations, they are
Mm.
all um, engaged in different social responsibilities, and as young professionals, so everyone, including the women, most of them are always on the move. So that also becomes one of the issue. And similarly, that's also one of the reasons why late age marriages are in the increase these days, and that's one of the very most important factor
Right.
in a
So,
case.
so getting married very late in life, which decreases the chances of getting pregnant. Infections also play a very vital role, which is not just sexually transmitted infections, but other forms of diseases and infections. And we have a timing issue.
Come again. I will get only half of your question.
Yes. So, according to you, infertility issues as seen by you is one, getting married late in life. Two, infections, not just sexually transmitted infections, but other forms of infections also, health concerns. And three is a timing compatibility issue.
Yes, that can be. Yes, that can be included as a subset of the first, of course.
Right.
And besides that, if you may allow, besides that, I should say that even unhealthy lifestyles,
Yes.
unhealthy lifestyle is also one factor which I've come across.
Yes, and I was coming to that point. Research shows that a major contributor for infertility is alcohol consumption, smoking, doing marijuana, drugs, and all these are one of the most major contributor of infertility among couples. And smoking, drinking is both by both the parties. So now it seems in Nagaland, drugs, alcohol, and all are like a lifestyle decision among many youngsters and among a lot of people. Now we see newspaper about substandard alcohol being sold in Nagaland in the black market because Nagaland is a dry state. Is this a concern? Bad quality alcohol, abundance of drugs.
Mm, let me put it this way. Since there's no proper study or detailed, researches being done, so I won't be able to say much on that. But whether it's a bad quality, good quality uh, alcohol as such, it's not supposed to be taken
Right.
along with those other substances.
Mm.
So I think just the changing, as we have mentioned, just the changing lifestyle, unhealthy lifestyle, it in itself it becomes a very big factor. And I would like to mention that unhealthy lifestyle, it doesn't just include alcohol, tobacco, or the drug habits, but even like we see these days, unhealthy food habits, less physical activities, and we can definitely see an increase in obesity among the partners.
Yeah.
So these are all major concerns
Yes.
in regards to
And eating habits also, food habits also play a vital role.
definitely.
Right.
So increasing the BMI, especially in the women,
Mm.
definitely plays a very big role
Yes.
regarding infertility.
Right, right. So here's one more question regarding the state of Nagaland. People with fertility issues go through a lot of emotional upheavals, whether they feel shame, whether they feel rejected by society, even though that might not be the case, whether they feel pain or just a lot of negative thoughts and thoughts. Now, do we have in Nagaland a call center or a contact center or a contact source point of contact for those people to seek help, even if it's for mental health issues related to fertility issues?
Actually, um, in our medical department, we have this district at the district level. We have this district mental health program. So under that, psychiatrists and nurses who are qualified in psychology and psychiatry, they are posted here. So definitely we can go and meet them or we can contact them. But especially in regards to infertility, we don't have such specialty sales that deal with it.
Mm, mm. Because if I were dealing with fertility issues, I would think twice about approaching, let's say, a healthcare specialist, even though they are the ones giving me solution to have the primary talk. I would rather give somebody a call or contact someone and have a preliminary talk. That option is not available in Nagaland, I presume.
Right now, no. And as of now, um, the treating doctor usually ends up being the person giving the counseling and doing the step-by-step, what do you call it, guidance to those patients
Right,
who come for those infertility
right. So the
issues.
doctor covers every aspect of fertility issues.
As of now, yes.
Dr. Supong, one last question before we wind up. For couples who are trying to get pregnant or start their fertility journey, do you have any advice as a practicing doctor?
There are lots of advice, but let me just stick to 1 or 2 points. Yep. And uh, there are lots of courses, different types of courses, and the course may vary from person to person or from couple to couple. But in general, though it's easier said than done, but the main advice would be to try to get married at an early age or plan to start a family at an early age. Since increase in age and increase in age has its own associated uh, factors, it becomes a major factor of fertility. So getting married early and trying to start a family early would be a very big bonus point regarding this issue. And secondly, uh, and I speak for everyone, especially those all those professionals who have who are really active and working very hard in their own professional lives uh, to maintain healthy lifestyle and especially to make time or to get time to spend quality time together, especially when you're trying to to start a family. And thirdly, especially I would like to advise them to seek for professional help at the earliest because there are lots of presumptions, there are lots of misunderstandings or miscommunication between the families or between the in-laws or the friends, and sometimes people they tend to seek advice or professional advice late, which actually I should say, which actually helps in delaying, which helps in delaying uh, the
Proper
time for treatment. And as I said earlier, since age is a big factor, so it's better to seek professional help at the earliest, and especially if there are some diseases or some problems involved, it's better to go for treatment early so that early diagnosis can be done and the proper treatment can be given at the earliest so that they will be able to fulfill their dreams of uh, starting a family.
Yeah. So basically, don't listen to the colony aunties and the family members' advice, but seek professional advice at the earliest. Seek professional help. Go to the doctor, which means, and get married early. Start planning family early, which is not really a choice for a lot of people, although healthy lifestyle.
Well,
Yeah, healthy lifestyle is most important, which includes eating on time, sleeping on time, and all those things, I would presume. And to make time and to spend time as a couple. That's your advice. Right. Thank you so much, Dr. Supong. We, from Subhag Health Tech, we wish you the very best to you and your family and to everything that you do, not just for your family, but for the entire state of Nagaland. May God bless you and your family.
So, I don't know.